Hello and welcome to the Neuromuscular Junction. My name is Dr. Mark Tarnopolsky. I'm the director of the Neuromuscular and Neurometabolic Clinic here at McMaster University. Today we're going to talk about mitochondrial disorders and how you can exercise safely to try and improve function. So the mitochondria is actually the powerhouse of our cell. Mitochondria are thought to be a bacteria that invaded a cell probably 1.5 to 2 billion years ago during evolution. And we've taken up a relationship with this mitochondria for that time period. What it's done is it allowed us to take oxygen, which at the time was low in the Earth's environment and is now at about 21% in our environment, and we could detoxify it and use it to help derive energy. The other thing that the mitochondria do is they take the food that we eat, and at the end of the day, all of that food comes down to provide what are called reducing equivalents, which go into the mitochondria, ultimately mixing with that oxygen that we breathe to provide the cells with energy. The mitochondria are present in every cell in our body with the exception of mature red blood cells, and they're particularly important and in high abundance in muscle, heart, brain, and that's why most often we find that patients present with manifestations that we would see in neurology. Things like seizures, cognitive impairment, ataxia, developmental regression, stroke-like episodes, hearing loss, decreased vision, and more importantly, from an exercise perspective, we see that the muscles can be weak and or there can be decreased endurance. And we've seen any one of those combinations. Oftentimes, the other clinical manifestations sort of override or mask the exercise intolerance which most people feel. But when you actually ask people, most of them have either weakness and or decreased endurance because we need the mitochondria to sustain any type of physical activity. So it might seem counterintuitive to actually exercise someone who has mitochondrial disease, and it's actually the weakness and the exercise intolerance that are, their main symptoms that they're experiencing. However, it's pretty clear from work done mainly through one of my friends and colleagues. Her name is Dr. Tanya Tavasalo, who's done studies with endurance exercise, and they've done studies with resistance exercise as well to show benefits in patients with mitochondrial disease. So let's start first with endurance. So with endurance exercise, what we do is we are going for longer duration activity, things like hiking or running or biking or rowing, elliptical, for example. And what happens is that our heart rate will go up to deliver the nutrients to our muscle. Our breathing rate will go up to bring more oxygen in so we can deliver that to the muscles. If the mitochondria don't work properly, we feel more shortness of breath. You get a rapid increase in heart rate. But when you exercise, the body will respond to that stress and it will adapt. That's a process called physiologic adaptation. And what was shown both by a group in Denmark as well as by Tanya's group is that if we do exercise training in patients who have genetic mitochondrial disease, very similar to the healthy population, the improvements are very similar. So what people generally would start off with is even as low as 3 or 4 minutes on a bike, for example, with low resistance, on a treadmill, for example, and gradually increasing that over time. Usually what we look at to judge exercise intensity is something called VO2 max. And the VO2 max is the maximal oxygen that your body can consume, usually expressed per kilogram of body mass and per minute. Patients with mitochondrial disease have a very, very low oxygen capacity. Most of them do. And when they start doing exercise, they're pretty much at their VO2 max doing pretty mild activity. So what we want to do is to go up to around 60–70% of your VO2 max. And how you will know that is you can use a heart rate monitor. Generally, you don't want to go much over, let's say, 150 beats per minute to start. Anything over that, especially when you start out, is probably too stressful for you. You want to get it at least over 100 beats per minute so that you do have a little bit of stress on the body, but not to overdo it. Listen to your body. Start off with a heart rate somewhere in that range. We don't want to overdo it, and everyone's different. Some people may be able to go 1 minute, some people may be able to go 4 or 5 minutes. The goal is to gradually creep that up over time as the body adapts. Generally, what we would do is start out, try the first bout of exercise, take a day or two to recover and listen to your body, go back again and maybe try either increase the intensity. So if you start at a heart rate of 130, you might want to go to 140, and or if you're at 5 minutes, you might go to 6 or 7 minutes. The ultimate goal, which is what the studies have shown as well, is that we're looking for generally 3 sessions a week, and we would recommend a session, take a day off, a session, take a day off, looking for at least 30 minutes of activity. So put on your favorite Netflix, music, whatever that might be, and try and eventually get up to that 3 times a week, Monday, Wednesday, Friday, however you want to space it out. Try and take an easier day or do something different on the off day and then go back to it so your body can adapt to it. And by following that sort of a program, Tanya and the Danish group both showed that there can be an improvement in mitochondrial function. The VO2, which is your maximal oxygen consumption, will go up. And in some of the studies too, they've even shown that this improves what's called quality of life. So there's a variety of different scales that measure quality of life. And if you can do your daily activities at a lower proportion of your maximum, because your maximum is now higher once you're fit, life is a little bit easier, and that's why the quality of life can improve. We've even had some patients who, when they do activities, even around the house, they can have decreased vision, they can have decreased hearing, and that can improve as you adapt to endurance type of activity. Now, it's really important when you do endurance activity to listen to your body, and I can't emphasize that enough, because if you push too hard and let's say you start to go deaf, you get sick to your stomach and your heart rate's 180, 190, you're pushing too hard. And often people then won't feel that recovery and they'll still be tired a couple of days later. If you still feel tired, back off. What we want to avoid is so much stress that either you don't recover and or you push yourself to actually break down muscle. So if you do push yourself too hard, and some of you may have experienced this previously by doing activity that you weren't accustomed to, where the muscles will be really sore for a day or two afterwards, and you may even see a change in the color of your urine. When your urine starts to go brown or red or black or Coca-Cola colored, that means that you've broken down the muscle too much and you've experienced what's called rhabdomyolysis. Now, that should clear if you drink lots of fluids, but if you cannot drink fluids, if it isn't starting to clear quickly or your muscles are very sore and you see that color, you really should go to the emergency department. But if you follow our safety tips and some of the tips I've given you here today, as well as seeing some of our videos about the practicalities of different types of exercise, hopefully you can avoid it. A few other things specific to mitochondrial disease is that if you've got a superimposed cold, fever, flu, gastrointestinal bug, if you're barfing and you've got diarrhea, take a day off. Don't add another stress to the system and let your body recover from that illness before you go back to activity. And then finally, resistance exercise. Really, there's not much difference between a person exercising with mitochondrial disease or the general population, other than, as I pointed out, start slow, gradually ramp up. And as mentioned, studies have clearly shown that people, especially with something called chronic progressive external ophthalmoplegia, can gain significant increases in strength when they do regular types of activity. Now, what they've done in the studies is they used weight machines, and we're going to show you how to use those in a subsequent video. But free weights, resistance bands, or even things like getting in and out of a chair with your own body weight to start with, are all forms of resistance exercise. And what the goal of this is to generally do 3 sets of 12 to 15 repetitions. So the last time you're doing the activity, it should be fairly stressful for you and hard to get that last repetition up, and then let the body recover, go and do different types of activity, go back to the same activity, and that would complete 1 set. And we're going to talk about those terms, sets and reps, in our Coming to Terms with Terms video, and then the specific types of resistance activity with bands and weights and various machines in videos if you're taking a look at our channel. If you have any suggestions with respect to other things that you would like to talk about with exercise and mitochondrial disease, please leave some comments in the comments section. And if you want to be alerted of subsequent videos, please don't forget to ring the bell, subscribe to our channel, and look forward to seeing you on another episode. Thank you.